have to be a sports fan to be talking about tennis champion Naomi Osaka going public with her struggles with depression and anxiety. Today, there's new reaction from the leaders of the world's 4 biggest tennis tournaments. Osaka dropped out of the French Open after refusing to do post-match news conferences. She made a very public plea to change how things are done. Today, the Grand Slam leaders released a statement saying, in part, mental health is a very challenging issue which deserves our utmost attention. We commend Naomi for sharing in her own words the pressures and anxieties she is feeling, and we empathize with the unique pressures tennis players may face. Those Grand Slam directors are promising to address players' concerns. Osaka's plea for better mental health support comes as millions of Americans head back to work after a very traumatic 15 months. Today, we find out the definition of mental health is changing in the workplace in a post-COVID world. Paula Tutman has been talking to experts, joins us now. Paula, give us a snapshot. What are they already seeing? Because I know some folks obviously have been already returning to work.
Yeah, they really have. And what they're really looking at is this shared experience we've all had with COVID-19 and how it's changed the way perhaps we view the world and the way we view ourselves in the world. And what I'm hearing is that also changes the definition of what mental health can be considered in the workplace. As workers prepare to return to the physical workplace, employee assistance programs are already reporting a boon in contact.
For the first time, we're seeing an uptick. Now, if you only saw maybe 3 or 4 a year and that upticks to 2025, that's huge. I will tell you that most of my education for my credits, for my certification have been through remote and webinars. And there has not been one session that I've attended where we did not speak about mental health. And if that doesn't wake some people up, it should.
Not everyone is in a position to quit a job, and so those anxieties travel with us. And when discussing mental health issues, the definition is changing in the workplace. Debbie Ritter is a human resources and benefits expert for UHY Consultants, and Cynthia Reynolds is a certified mental health professional and executive director of First Family Counseling in Bingham Farms.
We as a society have always focused on, the basics, anxiety, depression, like you said, bipolar disorder, but it's always been a continuum.
It's not your ADHD or you need some diagnosis of something. It's not about depression necessarily. And I think that's where I come from in the safety part. I think, overwhelming anxiety, those are things that I hope will send people to speak to someone.
And that's why, as the rapid change in guidance surrounding COVID outpaces the emotional comfort of where workers have been physically and emotionally for the last 15 months, it will be important to acknowledge and proactively navigate the real pressure points of mental health, diagnosed or not.
Everybody's at a different level now of what their comfort. Everyone is learning, including the bosses and the people in charge. So we have to be more understanding and compassionate about that.
Yeah, and what's also really important is for peers, employees, to understand mental health as well as mental illnesses and what those thresholds are. It's not just an HR thing, and it's not just a boss thing. It really is, and not just about tolerance, but acceptance of people's comfort levels and, Karen, their anxiety levels that will help this re-entry be a little easier, particularly for people who are suffering with mental illness or mental health issues.
It is a very real thing, that is for sure. All right, thank you, Paula, for the insight. We appreciate it. Tomorrow morning, Dr. McGeorge reveals how 4 U of M alums have created an app to help improve mental health. Find out how it works when you join us tomorrow at 6:30 a.m. Still ahead.